The Martin exam table is a full-featured power table with a low height of 18 inches and a 1,000-pound lifting capacity, providing superb comfort and care for all patients. With options for a foot control or hand control, the table allows for preset supine and home positions, as well as full manual adjustments, including the Trendelenburg position. A wide array of common accessories such as IV poles, instrument trays, armrests, arm boards, knee crutches, restraints, and screens may be used with the table. With industry-standard accessory rails inserted, the universal accessory clamps allow many accessories to be used in multiple configurations. Bed rails installed into the accessory clamps provide safety and stability for the patient. The bed rails also flip down to give full patient access and can be installed in multiple configurations. Like many accessories, med pans can be placed anywhere along the accessory rails on the seat and backrest, and in a podiatry position. Adjustable stirrups may also be installed into the accessory clamps. An OB/GYN configuration is also available. Every year, more than 200 patient injuries and even deaths from lifting equipment are voluntarily reported to the FDA. While many patients are injured in lifting accidents, the risk is far higher for healthcare workers. Each year, 44,000 healthcare workers suffer disabling back injuries. Each day, a healthcare worker lifts 3,600 pounds, or roughly the weight of a four-door sedan. Annual disability claims from healthcare workers lifting patients exceed $2 billion. To solve the problems with patient lifting and transfer, Martin Innovations designed the Chair-A-Table system with a state-of-the-art power table for all patients and a unique feature for patients in wheelchairs or those who need the aid of a wheelchair after their procedure. The Martin Chair-A-Table system provides the Martin exam table and the Martin wheelchair, allowing a patient to be transferred to an exam table in less than 30 seconds with zero lift, dramatically improving both safety and cost efficiency while completely eliminating the time and cost of an overhead or Hoyer lift. Ann Hudson, founder of the Work Injured Nurses Group, believes that the Martin Chair-A-Table can prevent disabling back injuries for nurses.
We used to actually have to deadlift patients, or we would either use the Hoyer lift. They were afraid because they're just kind of swinging. It's very hard to control. Since we've been using the chair table, it's been very beneficial for the patients. Most patients say they feel much more comfortable, much more safe. We feel safer for the patient. As far as our back, there's no strain at all. Patients all around seem very safe in it, very comfortable. You know, they're not afraid to go in that chair now. That once they use it once, that's the chair of choice now for them.
Dr. Richard Zollinger, a fellow of the American College of Surgeons, said, quote, "For generations of doctors in my family, we've witnessed the problems with lifting patients. With increasing ADA legislation mandating a better standard of care for patients with disabilities and the significant cost reduction the Chair-A-Table creates by reducing injuries and improving efficiency, it should be adopted organization-wide. With the medical industry migrating toward hospital chains, it creates an even bigger target for cost and injury reduction." End of quote. The Chair-A-Table system provides a significant cost reduction with an ROI from 2 to 6 months, a higher standard of care for patients, and injury prevention for patients and nurses. The docking function of the Chair-A-Table is also perfect for ambulatory patients who will need the aid of a wheelchair after their procedure. By adding the side frames to the exam table seat base, a previously walking patient can be wheeled away without ever having to be lifted. To avoid multiple wheelchair transfers, the initial transfer into a wheelchair is made to the Martin chair. The wheelchair, which is available in multiple widths accommodating patients of all sizes, backs over the exam table and docks into place. As mentioned earlier, a patient can be taken from a wheelchair to an exam table in less than 30 seconds. Once raised to a comfortable position, the side frames are removed, turning the wheelchair into a fully functional powered examination table. The Chair-A-Table allows patients requiring the use of a wheelchair to be transferred to an exam table with zero lift.
I've been in and out of the hospital now for about 30 years, I guess. I have been dropped, and it's hard on the nurses. When you get back here, you got to get a patient here, a nurse here, and you got to take two of them. This chair right here, this is a miracle worker in itself.
The Martin Charitable provides unmatched performance in patient safety, staff safety, compliance, and cost reduction. The Charitable, preventing disabilities while caring for the disabled.